If we look at blood flow through the arteries, we notice that blood flow is continuous through those arterial systems. But if we think about how the blood flows, we notice that our flow, right, was a product of the changes in pressure. But we know that if we look at the aorta specifically, right, that we have this rise in pressure, we have this decrease in pressure, we have the rise in pressure, decrease in pressure, rise in pressure, decrease in pressure. And this corresponds to ventricular systole, right, and ventricular diastole. So if we have this sort of like rise in pressure, decrease in pressure, why isn't that the blood doesn't just like flow, stop, flow again, stop, flow again? Well, if we look at sort of a crude drawing of, let's say that this is the ventricle here, and we're going to say this is the aorta here, and then we're going to put we'll just do it in purple, sort of the next vessel, like so, right? Now, when the ventricle pumps blood into the elastic arteries, right? So the ventricle is going to pump that blood into the elastic arteries. They're elastic. What does that mean? They have elastin in them so they can swell, like so, right? So they're going to accumulate this high amount of blood that is getting pumped into this region here, right? So then as the ventricles relax again, right, as the ventricles relax again, what's going to happen is that the elastin, right, is going to sort of recoil that elastic artery. So as we recoil that elastic artery, what's going to happen is it is going to push blood into the rest of the arteries, even though this ventricle is in diastole. So we'll say that's ventricular diastole. This is ventricular systole, right? So because of that, the flow, right, the pressure here, right, pushes blood in that direction, and then the pressure here pushes blood in that direction. So because of that, right, we do not see a pulsating flow of blood throughout the circulatory system, right? And because of that sort of expansion of those blood vessels, we can actually feel that pulse in some of the arteries themselves. So blood flow is continuous, even though the cardiac cycle and the pump that we use does not continuously pump blood into the arterial system.